Well, good morning, everybody. Let's have that first panel come up here. So, hello and good morning. Welcome back to the second day of the workshop on health system interventions to prevent firearm injury and death, hosted by the National Academy's Board on Population Health and Public Health Practice, sponsored by Kaiser Permanente and the American Hospital Association. And really appreciate that once again, both the work, the sponsorship by Kaiser and the American Hospital Association to enable this this important conversation to move forward, and the hard work of the staff of the under Rose Martinez and the Board on Population Health and Public Health Practice, in particular Melissa French and Alicia. So I'd like to remind everybody that the workshop is being live streamed as well as videotaped and recorded. And for those of you who are joining us this morning on the webcast for the second day, I'll remind you that the window, I'm understanding that the window that displays the video of this has underneath it another window where you can type in questions. Those questions will be monitored by the staff here in the room and collected, and during the question and answer periods that are associated with each discussion brought forward by the staff so that we can have the experts assembled here respond to them in real time. So I do encourage you to do that, as well as obviously those of you in the room. And we have a grand room and a smaller number of attendees because this is the room that was available to us when we put this workshop together. So, but I encourage those of you in the room as well as those of you online to really submit your questions and comments, because the conversation, in addition to listening to what the experts have to tell us, is very helpful in helping us move forward in terms of knowledge on this topic. So yesterday we heard that firearm violence is a complex biological, social, and psychological issue that is taking an incredible toll on individuals, families, and communities. And if you're not persuaded that that's the case, then you weren't listening very carefully yesterday. I thought the presentations were pretty clear in laying out the compelling nature of this issue. We also heard that the issues and challenges of identifying those at high risk for firearm violence and about research into interventions to prevent firearm-related injuries. All of this was in the context of the role of the health systems, the role that health systems could and should play in tackling this complex public health issue. And I'd remind you again today that our focus is on what health systems can do, and other conversations that on other occasions will address some of the policy and other more controversial issues. So we're focused on those, what we can do, health system sorts of issues. So I'm particularly interested in how we start this second day of the workshop. We'll start our fifth session focusing on programs and research. We have Dr. Joel Fine, who will moderate a discussion. After Dr. Michael Levis presents on Project Ujima, Dr. Ali Rohani Rabar presents on clinical trials for helping individuals with firearm injuries. Dr. Rebecca Cunningham presents on 2 research projects on preventing injuries among youth. Dr. Renaud Benitez, I hope I got that right, presents, Betas, I'm sorry, presents on participatory approaches to implementing firearm safety promotion in pediatric primary care. And Dr. Kyle Fisher presents on the state of the science for hospital-based violence interventions. So I believe the plan is to have those presentations occur and then have the conversation. Is that what you're going to do? So I'm going to take my, in my role as moderator, remind you to accumulate your questions over the course of these presentations so that that Q&A session, when it occurs, can be particularly lively and informed. So after the moderated question and answer period, we will break. A complimentary lunch will be provided here and will be available in the Great Hall just outside of the room. Then we'll reconvene after lunch for session 6 on developing networks and sharing information. Dr. Gregory Simon will discuss building a learning healthcare system for suicide prevention, and Dr. Linnea Ashley will discuss the importance of networking and sharing best practices between systems, and a moderated question and answer session will also follow that session. So that's what's coming after lunch. And then the last session of the workshop will be moderated by Dr. Stephen Hartgarten with Dr. Jay Batt, Shannon Cosgrove, and Deborah Cools, discussing the development of a culture of health, a culture of healthcare providers as interveners. In other words, what does it take to shift the culture of healthcare providers to take action? A question and answer session will follow that, as well as a brief reflection on some of the key issues from today, and then that will conclude the workshop for today. So that's our plan for today.